Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. In the last class, we have discussed about some of the different causes which set the body temperature at a higher level. Now, today we will discuss another facet of the fever. How do you guess the cause of the fever? Isn't it? Now, the cause of the fever may be infectious, non-infectious, environmental, and some drug fever, atropine fever, dehydration fever. Many causes are there, or some hormonal problems. Okay, theratoxicosis. There are many causes of fever, malignants, etc. Now, how do you guess the cause of the fever? Now, for this we have to understand two important basics. What is that? Suppose if there is some noise which is coming from campus of your college. Yes, you are getting a big noise from your college campus. Suppose I'm giving an example. Now we need to know what actually this is, isn't it? So first you identify the place. For this, first you identify the place. Yes, you are quite ensured that this voice is coming from the campus only. Then you identify the place from where actually this sound is coming from within the campus. Is it from the classroom? Is it from the staff room? Is it from the corridor? It is from the ground, or is it from the canteen? Okay, so like this, now first you have to identify actually from where this sound is coming. Okay, now every time the cause is different depending upon the place. How means, suppose if the sound is coming from the classroom, definitely some of the students may be doing some mischievous things. If the sound is coming from the canteen, definitely so many people are talking together and they are doing some fun there. If the sound is coming from the staff room, there may be something, the principal madam may be scolding somebody. If the sound is coming from the corridor, maybe students are playing in the corridor. Isn't it? So depending upon the place from where actually this sound is coming, the cause is also different. Suppose if the sound is coming from out of the campus, place out of the, for example in the road, a big sound is coming. So then it may be in a road accident, or it may be some bomb blast sometime, or it may be some other issues. So what I mean to say is, depending upon the place, the cause of the sound will going to differ. Okay, so if sound is there but people are very happy, for example inside the classroom sound is coming but students are chatting, okay, so they are very happy, then sound may be due to a fun moment and there is no much severity. Okay, sound is there but everybody is running, sound is there but everybody is running, it may be a bomb blast or it may be an accident. Okay, sound is there but everybody is panic, it may be a bomb blast. So what I mean to say is, you have to identify the place from where actually the sound is coming, and you have to also identify what is the reaction of that particular reaction to that sound by the environment. Okay, so similar is the case with the fever. So look into the place and as well as the environment before telling that what is exactly the cause of the fever. Okay, in case of the sound, we have looked into two important aspects. One is we have looked into the location, place. Another one is we look into the environment. Students are producing some sound in the class, but they are happy. Environment is happy. Okay, there is a big sound in the road and everybody is running. That means an accident. The road is the place and people are running, that is the environment. So like this, to identify the fever, we have to look into two important things. Number one is the place of the body from where actually this is originated, and number two is what is the response of the body to that particular tissue injury or that particular infection or whatever. So these two things are very important. So in other words to say, what I mean to say is we need to know the anatomy. Anatomy is nothing but place. Okay, So place and environment, these two we are discussing about. Place means in the body, it is nothing but anatomy. So whenever we have got the fever, first you need to identify the anatomical area to which this particular fever is attributed. That is very important. In many cases, the patient comes with the fever, but there is no clue about the anatomy at all. Many times it happens, isn't it? Child is having the fever, all over the body there is feverishness, everything is there, but there is no clue from the body at all from which place it is originated, whether it is originated from the oral area, tonsil area, pharynx area, or urinary tract or GIT. There is no clue. There is no other symptoms. There is no other symptom. Simply fever is there. That means we are not able to identify the anatomy there. Okay, we are not able to identify the anatomy. Sometimes we have to, but if you wait for some time, then you will get the clue. Suppose for the first 2 or 3 days there is no, only fever, there is no other symptoms. But on third day onwards, the child started with the tonsillitis. Then you got the anatomical clue. Okay, sometime, so we have a clue regarding the site later. For example, tonsils enlarged, or there is a mucus stool, then the anatomy is in the GIT, or there is some boils in the skin, anatomy may be there in the skin. So this is very important. Before treating the fever, identify the anatomy. Okay, so most of the time there is no clue at all for 2 to 3 days. But how to identify the place of anatomy? How to identify this place of anatomy? So we need to ask about few questions to get the clue. During this time, suppose only fever is there, but there is no clue about any anatomy, then we have to ask about few questions to get the clue. Every parents come and they desperately want to reduce or suppress the fever of the patient. Now, only fever is coming, parents are worried, and their motto is very simple, they want to reduce the fever. Patient is not worried about the cause, but as a doctor we are worried about the cause. What is the cause and what is the place? But for patient this is not required. Patient want to get reduce the fever. So but we have to identify the cause and then we have to treat it. Okay, so otherwise it leads to treatment failure. That we know. As a doctor we know. But parents, they don't know. Parents are desperately want to reduce the fever. Sir, whatever may be the cause, whatever may be the area, anatomy, sir, first this fever let get reduced. But as a doctor, this is not our motto. Fever be there, no problem. But first I have to identify the place from where actually it is coming. Where actually the tissue damage has taken place. This is my motto. Okay, so we need to get best out of this fever. Fever is coming. Now we need to try to accumulate the informations. If I suppress the fever, then I cannot accumulate any informations. Okay, so that is the important aspects. So to know this, okay, so place and environment. So these two are important, anatomy and as well as the symptoms. So now there are 5 important questions that you have to ask to the parents. What are they? Onset of the fever, response to any antipyretics, interfebrile period, response and progress of the fever as the day passes, and associated symptoms. Now we will be very clear on this point. If you are able to ask these 5 questions to your kid or parents, then you can able to gather maximum information. Otherwise you will going to miss the track in the beginning itself and it leads to treatment failure. Patient may goes to other doctors. Okay, and these are the 5 important questions that you have to ask. How to ask and what is its importance, what is its significance, that we will discuss in the next class. Thank you very much.